This program is funded in part by grants from the Foundation for a Healthy Kentucky and the Kentucky Medical Association through a grant from the Anthem Foundation.
Welcome to Fighting to Breathe, a KET forum. I'm Renee Shaw. This forum is the culmination of our three-part series, Fighting to Breathe, which explores the undertold story of lung disease and the burden of lung cancer, COPD, and asthma in this state. We encourage everyone to watch it on our website, ket.org/respiratory. In our discussion here today, we want to pull back the lens and look at the policy and system solutions that can make an impact and move us forward as a state. I'm joined in our Lexington studio by Dr. Ellen Hahn, Professor and Director of Breathe and UK Cares at the UK College of Nursing. Shannon Baker, Director of Advocacy for the American Lung Association in Kentucky, and Dr. Connie White, Deputy Commissioner for Clinical Services, Kentucky Department of Public Health. Welcome to you all. Thank you for being a part of this program and our others as well. It's good to see you all. So I want to start here. We know that Kentucky leads the nation in lung cancer rates and in death. So chronic lower respiratory disease is the number 4 cause of death in our state. Why are we not talking about respiratory issues, Dr. Hahn, more than we are? And maybe perhaps these series of programs will make a difference.
Big industry, like the big tobacco industry, spends millions of dollars marketing their products in Kentucky and elsewhere. So we don't talk about it because we don't invest in tobacco control and in lung health.
Dr. White, what do you think?
Well, I agree with Dr. Hahn. Our funding is low. We try to be as efficient as we can with the funding that we have to reach as many people as we can, but the reach that other interests have vastly outdo anything that we can manage to balance against that.
Yeah, Ms. Baker, though, that your association really tries, right, to bring this to the forefront.
Right.
How would you rate how we've come in our acknowledgement of lung health issues and our standing when it comes to lung cancer rates and death? Do you think that we're getting better about understanding where we are and doing something about it?
I think we've made some progress. We have miles and miles to go yet. At the Lung Association, you may have heard, when you can't breathe, nothing else matters. And that's certainly becoming more prominent in the conversation, particularly during a respiratory pandemic, of course. There is a lot more conversation about lung health now, but you're absolutely right. When it comes to tobacco, when it comes to radon policy, we have a lot more education to do, and we're working on it.
Yeah. I know, Dr. Hahn, you've talked to us a lot about smoking and smoking cessation, and so I want you to talk to us again about the toll it can take on our health.
Yes, smoking is the single most preventable cause of death in the world, actually. And Kentucky is one of the leaders in that, sad to say. Our adults smoke at really high rates. Our children are smoking electronic cigarette products at high rates. It takes its toll. And around 10,000 people in our state die every year, needlessly, really, from this addiction. It's a severe addiction. And not only is it a toll to our health, but we spend billions of dollars in healthcare costs treating people who are smokers. And it's staggering. And employers spend millions a month and billions a year, not only in healthcare costs, but at the productivity losses as well.
So what role does public policy play?
Huge. Policy makes the easy choices, the healthy choices, the easy choices. People don't have to think when they go to work. Am I going to breathe clean air today? If your workplace is smoke-free, you don't even have to think about it. So policy is the most effective lever that we have. And unfortunately in Kentucky, we haven't done all the things that we need to do that other states do. We do have some good news, though.
Yeah, I was going to say, do we have some victories, right?
We do. We have 41 communities now in Kentucky that have strong smoke-free protections.
Remember when that was just a handful?
Yeah, I remember
More than
when
a few years
Lexington was
ago.
the first in
That's
the
right.
South and the Midwest, and we have 41. The most recently, Owsley County Fiscal Court. And so really, it's not just in the big cities. Rural communities are taking it on. Local officials know what's good for people, and they're doing the right thing. They're covering everybody. We have fewer lung cancer cases in communities with strong smoke-free laws. We have lower asthma rates, lower COPD rates, you name it. We're able to show that it's a good investment.
Yeah. Shannon Baker, tell us where we stand when it comes to funding for tobacco cessation programs and control programs.
So the Centers for Disease Control and Prevention would recommend that Kentucky invest $56.4 million toward prevention and cessation programs. In fact, our current funding level is $2 million. It's a long and sad story of cuts year after year. We are at a 14-year low right now, and we need to do something fast to reverse that. And so the legislature right now is considering the next biennial budget. And as we sit at $2 million, it's just not enough. Our kids deserve better, and our legislators need to do better. So at a minimum, we need to go back to the pre-pandemic level of $3.3 million. It doesn't sound like a lot, just an incremental $1.3 million, but it does make a big difference. It puts educators in schools, tobacco control coordinators in our local health departments, and it helps prevent our kids from ever initiating. So with these e-cigarette products that we've been talking about, 1 in 4 high schoolers, probably more than 1 in 4, is now using an e-cigarette. We can prevent that through education.
And we know middle schoolers are using them as well at pretty alarming rates, right?
It's true.
Yeah. So Dr. Connie White, you with the state. So tell us how the state's using the funds that they have, and what do you think about a higher appropriation for this upcoming biennium? Is it possible that that could happen?
Well, we certainly have programs that we could expand or start if we had new funding. We're focusing on young people and keeping them from starting to smoke, because most people start smoking before they're 18. We're looking at smoke-free environments so that you can learn, work, and play in a smoke-free place. We're looking at helping people that are smoking already to quit, because most people who are smokers say that they want to quit if they just had that easy choice and an opportunity to do that. So we've got the Quit Line that we have, which is free to all Kentuckians, and most people qualify for either nicotine replacement, either through the Quit Line or through their insurance company. We've got the My Life, My Quit, which is a new CDC program for teens that focuses on vaping. We are funding 21 of our health departments with the smoking cessation programs that they have, and can work with local communities to help businesses go smoke-free and to teach smoking cessation classes. And then we work in our schools to work with training younger kids by older kids, helping them to understand the consequences of smoking.
Yeah. And are those cessation programs successful? When people try to quit, do they stay?
The American Lung Association programs that we do in our local health departments are very successful. So we're very pleased with that. It's just getting enough people to be able to offer those classes.
Yeah. Ms. Baker, as we talked, there was a bill that was introduced for this legislative session that we're currently in that would allow local control of tobacco control measures. So talk to us about that. Why is that significant? Why is that important?
So that bill was just introduced yesterday by Senator Schroeder, and we are so pleased that we're finally seeing a piece of legislation during this session that we can move forward on. And so, a little backstory. Back in the late 1990s, at the behest of Big Tobacco, a number of states, including Kentucky, passed a statute that prohibits local communities from passing any tobacco control ordinances other than smoke-free. So we have a situation where we've effectively tied the hands of local elected officials when they want to, when the community wants to address tobacco and the harmful effects it's having on their kids. So this new piece of legislation would reverse that. It would repeal that state law, and it would restore the local option when communities want to. It's not a mandate. It just gives communities the opportunity to do such things as, let's say, create buffer zones around schools where e-cigarettes cannot be advertised, for example. So it's an important piece of legislation because it restores the local option to do the right thing.
Yeah. Dr. Hahn, I want you to talk to us about the harms of vaping. We talked about that a little bit, about the rise in not just high schoolers, but middle schoolers as well, taking up this habit and it having some harmful effects. So talk to us about the harms of that, and is there legislation that we can look forward to that would address that?
Right, so electronic cigarette use or vaping is not harmless. It actually causes lung damage. We know that. As much lung damage as a conventional cigarette. And it's harmful. A person using electronic cigarettes is a lot more susceptible to infection. And of course, in this pandemic, that's a concern. There is 2 to 3 times the nicotine in these products. There are harmful chemicals in those products, and more importantly, there are tiny, tiny, tiny particles that are in the aerosol. So it's not water vapor, it's aerosol. So it's not harmless, and our kids, we have a dramatic increase among youth and young adults. Policy is important, and a few years ago we did raise the price a little bit on e-cigarettes. The problem, though, is it's not fair the way that those products are taxed. They're taxed at really low rates, and they're differentially taxed. So electronic products are either closed or open systems. They're different kinds of electronic products. And so for some reason, they chose to tax them differentially. So some of those systems are taxed at different rates. So essentially what happens is the user chooses the one that's going to be less expensive, right? Sure. And youth particularly are very price sensitive. So we know that parity, and that's the term for all the products being taxed at the same kind of rate, we are one of the lowest states in the nation for taxing conventional products. It's $1.10 a pack, so we're one of the lowest. But even if we'd raise the e-cigarette tax to meet the price of the conventional products, we'd have to increase it by 23% of the wholesale price. So we got a long way to go.
Right, and that's not going to happen this session. And incremental progress is the way to look at that, right?
Right, and then obviously we need tobacco control funding so that we can give the right messages, because David and Goliath, the industry spends so much money marketing their products. We are running to keep up behind them in public health. We don't have the funding to put powerful ads on TV or powerful ads on social media or other media, radio. So children and young adults get the message, right? The only message that they get from the tobacco companies, because they have the money to spend to market the product. So we have a long way to go.
Yeah.
Yeah.
Well, now we'll turn our attention to talk about lung cancer and something that's getting a lot of attention, and that is low-dose CT scans for lung cancer screening. To help us learn more about that life-saving tool and other issues related to lung cancer, I spoke earlier with Dr. Jennifer Knight by Skype. She's with the Kentucky Cancer Consortium and the Kentucky Leads Collaborative, which stands for Lung Cancer Education Awareness, Detection, and Survivorship. Jennifer, thank you so much for giving us a few minutes of your time today.
Absolutely. Thanks for having me.
Yes. So tell us about the prevalence of lung cancer in Kentucky and why it's such a concern.
Well, lung cancer in Kentucky, unfortunately, we are #1 in lung cancer. We have the highest number of new cases and the highest number of deaths from lung cancer in the whole country. And this is really related to a lot of different things. We have a long history of tobacco and smoking, and so that elevates our rates. But also, we've got a lot of environmental exposures that, when combined together with smoking, really make it a high risk place in terms of lung cancer.
So let's talk about screening tools. What is a low-dose CT scan, and why is it such an effective screening tool?
Well, basically, it's a screening that allows people to lay down in a big tube that comes around you, and you go through it, and it does a low-dose scan of your lungs. And in the right population with informed and shared decision-making, it can really detect lung cancer at its earliest stages and reduce deaths from lung cancer. And so in terms of who is eligible, it's those age 50 to 77 or 80, depending upon the guidelines and a conversation with your doctor. Those who have what's known as a 20-pack year smoking history. So you've packed or smoked a pack a day for 20 years. Those who are currently smoking, and those who have quit smoking within the last 15 years.
And should those who never smoked be screened?
No. Actually, at this point in time, we don't know the risk-benefit ratio. So what we know is lung cancer screening and the follow-ups to lung cancer screening can have benefit and have harms. And we know that those who fall into this risk profile have usually more benefits than harms, but they again need to talk to their doctor to figure out their specific situation. Those who have never smoked really have more harms than benefits of getting a screening. So we don't want folks that don't fit that profile. There's still more research into that. There's more biomarker testing and things we need to figure out. But at this point, those who are never smokers, even if they have other exposures, lung cancer screening at this point in time is not quite right for them.
So it appears that Kentucky is doing quite well when it comes to screening. Like the rates of screening are pretty high in Kentucky. Why is that?
Absolutely. Well, it is really exciting. It's a success story that we don't often get to have around a health-related issue. But this has happened because of multiple things. We've had multi-level coordinated engagement and partnerships around lung cancer screening really since 2013. The Kentucky Cancer Consortium created a lung cancer network to say, hey, let's come together, work together in this. The Kentucky Cancer Program kicked off community outreach in 2013. We have the Kentucky Leads Collaborative, lung education, detection and survivorship that really focused on primary care education, high quality lung cancer screening, survivorship care. And then we've got the Terminate Lung Cancer Project that really kicked off in Eastern Kentucky. And all of these things coming together and people working together have done that in a way that no other state really has. We actually have people looking to Kentucky saying, what did you guys do? This is incredible. And how can we do it too?
Yeah, certainly it's a success story that we don't tout enough, I think. So is there room to make it more widespread?
Absolutely. So even though we are kind of second in the country in terms of lung cancer screening, our rates of screening among those who are eligible are still like 17%. So if you think about other types of screening like mammography or colon cancer screening that are up in the 70s, 80s, those kind of things, we've got a ways to go in terms of getting the people to go. And there's a lot of things we can do. We can continue the collaborative efforts. We can expand access to high quality lung cancer screening in health systems throughout the state and really increase community engagement. We can also help change the conversation and continue that conversation that reduces stigma around lung cancer and nihilism, rather than saying, hey, you deserve it or you blame or shame kind of things, moving to, hey, these are our community members. These are our brothers and sisters and our friends and our neighbors, and being compassionate and empathetic and really engaging folks in a positive way and in a way that brings hope. Because there's a lot more hope than there's ever been around the lung cancer story. And we need to keep sharing that and changing the conversation about it.
Yeah, that stigma is a big part of this discussion, isn't it? What else could we be doing to help reduce that stigma?
Well, there's a lot of things we can do. One of the tools that we are using often is from the International Association of the Study of Lung Cancer. Say that 3 times. But basically, they have created a lexicon that helps us change our conversation in our language. So for instance, some of the recommendations are person-first language. So rather than saying a lung cancer patient, a person who has lung cancer, or rather than saying a smoker, a person who smokes. And then the other piece of that is changing the conversation from always saying prevention to saying risk reduction. And I had the opportunity to learn from some lung cancer survivors who said, hey, we don't know that we can always prevent it. And when you say prevention, you're saying it's your fault. But if you say risk reduction, we're saying, hey, there's things we can do to reduce our risk, but we don't always know if we can prevent it. And that takes that blame off of that individual person.
Interesting how important language is in all of this. So thank you very much, Jennifer Knight, for that very insightful information that you share with us. We appreciate it.
Absolutely. Glad to help.
Shannon Baker, I want to ask you about another piece of legislation. I believe this is helmed by the Health and Family Services Chair, Kim Mosier. This was House Bill 219. Can you tell us about why this is important when it comes to the conversation about screening?
Absolutely. And so the problem with lung cancer is that it is typically asymptomatic until it's in its most advanced stages. So you don't know you have it until treatment is less effective and outcomes are not as good as they could be should we have early detection. So this piece of legislation is critically important. We have done well in Kentucky with advances in lung cancer screening, but there are still disparate communities, and there are still huge opportunities to expand access in rural Kentucky communities where there are so many barriers to access to quality lung cancer screening, and this bill would help address that by establishing an advisory group, if you will, a panel of experts who would come together and talk about the ways to address those barriers, to overcome them, and to expand lung cancer screening in all those communities all across Kentucky so that we can get to earlier detection, better treatments, and better outcomes.
Yeah. Well, we do want to end this portion of the discussion with a message from someone whose life was saved by a low-dose CT scan.
Where you can see this tiny little spot there, and that was your cancer. It was just a quarter of an inch and a little bit of like some...
Initially, I went in for an annual exam with my family physician, and he requested that I get the low-dose CT scan as a baseline record for any future ones. And we had a follow-up in a year, and that's when they spotted something. And then we waited for 3 months to see if that little spot would grow any, and it did. So that's when we decided to do the surgery and the thoracic surgery, and they went in and did a wedge, and it was cancerous. They got it all, and I did not have to take radiation and chemotherapy due to the fact that I did the early lung screening test. I tell everybody that I know to go get the scan. It's well worth it. Your life will be protected by having it.
So now we want to talk about, we know that smoking and the ill effects it can have, but radon. Now talk about something that we don't often talk about, although there seems to be more traction toward this, Ellen Hahn. So talk to us about what we should be concerned about when it comes to radon.
So radon is a colorless, odorless, tasteless gas, meaning it's invisible. It's the invisible enemy is what we call it. It's nobody's fault. It's in the ground, it's in the rock. So we collaborate with geologists because we need to learn more about the rock and the soil under our homes and our buildings. So this radioactive gas gets in our home and we breathe it, but we don't know it. So the only way to know it is to test for it. It is the second leading cause of lung cancer. We estimate about 700 or almost 1,000 radon-induced lung cancers a year in Kentucky, actually. A lot of people don't realize it's that high. So after tobacco smoke, first and second-hand tobacco smoke, radon is the second leading cause of lung cancer. So it is an important issue. We definitely can do something about it. We can test. But only 13 out of 10,000 homes in Kentucky have been tested for radon.
I want you to repeat that statistic again. I think that's worth hearing twice.
So it's only 13 out of 10,000. So it's less than 1%. So 13 homes out of 10,000 homes have been tested for radon. Ever. And,
yeah. And there was a means by which we all could improve those numbers and even protect ourselves. Well, your program, Dr. Hahn, is conducting a study called Radon on the Radar, which is targeted to 4 Kentucky counties with high radon levels: Logan County, Christian, Pulaski, and Rowan counties. We went to Logan County to learn more about this study and how it's helping to raise awareness of radon in these communities. We have a short clip, so let's watch.
Hey guys, how's school? Good. Would you like an apple?
Natalie Davenport is one homeowner who never suspected that her home could be filled with radon.
This is my dream house. My husband and I moved here about 3 years ago. This is his family's farm. He grew up on this farm, and we decided that we wanted to leave the city life. So we built this house, and we've loved every minute. Our contractor actually asked us if we wanted to put in a radon mitigation system as they were building the house, and I declined. It was a little extra money, and radon wasn't something that was really on my radar at the time. So I told him no, we'd be fine.
Thankfully, Natalie found out about a new study designed by the University of Kentucky called Radon on the Radar, targeted to 4 Kentucky counties with high radon levels.
The main goal of the Radon on the Radar study is to make it easier for people living in these 4 rural counties to be able to test their home and afford radon mitigation when high levels of radon are found.
Natalie signed up to be a citizen scientist with the study. As a citizen scientist, she received education about radon, allowed her soil to be tested by geologists from the Kentucky Geological Survey, and received a digital measuring device to monitor her radon levels.
My first radon test was a lot higher than I thought. The testing should be less than 4. That's kind of when you're in the safe zone. But our first test was over 30. So the first thing I thought of was I brought my children to this home. I built this great home for them, got them out of the city so they could grow up with all this fresh air in the country. And then our house is filled with radon. So I panicked a little bit. Everybody from the University of Kentucky, they were so kind and, talked me off my ledge and they helped us find a mitigation system. I was calling to tell you about a radon study that I was
Natalie's radon levels are now within normal limits, and she's spreading the word throughout her community about the importance of radon testing.
We live in Kentucky, and when you think about lung cancer, you think about smoking. And smoking is such a big thing in Kentucky. But radon is right there with it.
Hey, I understand you guys have some radon detectors.
As part of the Radon on the Radar study, digital radon detectors are being placed for checkout in community libraries in each of the 4 counties.
We have 25 kits available. Our goal would be we'd love to have the good problem of not having any kits available and people having to wait to get them, that they're that popular one day. But I think an important part of what we're going to have to do is make sure the community understands the importance of radon's danger to them and their families.
This is our radon mitigation system.
Natalie received a voucher from the Radon on the Radar study to reduce the cost of mitigation of her house. But she knows the mitigation costs are a barrier for many.
I would like to see it affordable for everyone so that everyone has the opportunity to have their home mitigated.
We're working really hard and contacting all kinds of community partners to find ways to make radon mitigation affordable and accessible to everyone. We're up for that challenge, and until we can make radon mitigation the easy and affordable choice for everyone, we won't stop.
That's what it's all about, right? And we thank Natalie for allowing us to come into her home, and also the voice you heard on that piece being narrated, that is Dr. Wayne Tuckson. You're very familiar with him, who's the host of Kentucky Health, so we thank him for helping us out. I want to go to you, Dr. Hahn, because first of all, Natalie is in a seemingly new build home, as we would say, right? This isn't, that home probably isn't 5, 6, 7 years old, right? So we would think that homes would already come, new builds would come with radon detection automatically. That's a wrong assumption, right?
All right. And so some states, very few, but some require builders to use radon-resistant new construction. Natalie mentioned that she said no when the builder asked her, but it's actually less expensive if you do it from the beginning. It's something like $400 versus $800 to about $2,500 if you do it later, But, we don't have that policy, that law in Kentucky. We do not require builders. Some do. Some are very responsible and they do, but they give the builder, the homeowner, the option. And it would be great if there wasn't an option, if they just put the pipe in the home so you couldn't see it from the outside. What they do then is they just have the option to put the fan, in the pipe later if they have radon. The thing is, you don't know if your building whether there's radon that's going to be in your home or not until you close up the home and test it.
And so we heard Natalie say that 4 was the average, I guess, and she registered at a 30. I mean, we can't really conceptualize what that means in terms of severity or harm that could be caused. Put that in perspective for us.
Right. So the Environmental Protection Agency in our country uses 4 picocuries per liter. It's the way we measure it, as actionable, meaning that if you have 4 or above, you should fix it. The World Health Organization, though, says 2.7 picocuries or above, you should consider fixing it. So I think we're going to see that number of 4 eventually going down, because we know that even low levels, particularly when you're also breathing tobacco smoke, that your risk of lung cancer is 10 times higher. So breathing radon is dangerous for everyone, but it's more harmful if you also have tobacco smoke exposure.
Right. So talk about the cost of mitigation, right? How much, I mean, you kind of mentioned that it's, if you do it on the front end, it's better than doing it on the back end.
Yes.
That could run you maybe 4 figures. The cost of mitigation, is that what it's about?
It depends on where you live and how large your house is, what type of foundation you have. Do you have a crawl space or do you have another kind of foundation? But it is a law in Kentucky that you have to use a certified radon mitigation professional to fix your home, and there are those you can, there's a website where you can go to see who is actually certified to do this work.
Well, you want to make sure that you get that, right?
Yes, yes, definitely, because you don't want just, you don't want to do it yourself.
Right.
You don't want to DIY it. You don't want to ask just a plumber or an HVAC person. You want to ask somebody who's been trained to do it the right way. We unfortunately had a bad experience with a home, not in the current study, but another study where the homeowner said, "Oh, they put that system in my house already." And so he said, "Oh, I haven't tested in a while," when we do recommend every 2 years, regardless, that you test. And he tested and it was 40, so it was really high. But the person that had put it in was not certified. And so the pipe, instead of going out the roof, went into the child's room.
Oh, mercy.
So actually the levels of radon were very high, even up in the child's room. So, it's a myth that radon just stays in your basement, and if you don't have a basement, you don't have to worry. Not true.
Right.
We have participants in our studies that have been in mobile homes, and they have radon, even though they're up on blocks. So don't assume that you won't have radon. And if your neighbor has it, guess what? You may not have it, or your neighbor may not have it and you have it.
And you have it, right.
Yeah, it's a noble gas. It's a gas.
Yeah.
And the rock in the soil below your home really depends on how much is even available to get in your home.
Yeah. Shannon Baker, talk to us about where we stand on the policy front when it comes to radon detection and all of these other issues.
So more than 1 in 3 homes in Kentucky has elevated levels of radon. And elevated levels are present in every county across the state, all 120. So this is a place where we can talk about some policy success and some policy opportunity. And so a few years ago, we were successful in amending the seller's disclosure form in the event of a residential real estate transaction to include language about the risks associated with radioactive radon in your home. And the language also suggests that if a seller has tested, they should disclose that information to a potential buyer. And now the Lung Association, with a grant from the Environmental Protection Agency, has launched an extensive and coordinated education campaign to reach realtors and to explain to them the risks associated with radon, the importance of testing, and the importance of fixing your home, just as you would if you had your home inspected and your water heater needed replaced, you would replace the water heater. So that language is now in the seller's disclosure form. The education campaign is afoot to reach realtors so that through them the message can be amplified to home buyers and sellers. Now, what could we do? What more could we do? We should be testing K-12 schools. We should be testing daycare centers, because radioactive radon exposure is cumulative. And so we're sending our children off to school to spend hours and hours and then they come home and maybe their home hasn't been tested. And as you heard Dr. Hahn say, that's typically the case. We should be testing in schools, and we are hoping to include language in the upcoming budget to require testing and to fund testing in K-12 schools.
And mitigation? Do you go as far as funding the mitigation for schools that need some type of remediation of radon?
So that's a next step potentially. And there's also, as Dr. Hahn mentioned, radon-resistant new construction techniques that we could be talking about down the road as well. There's a lot to be achieved in the legislature around radon.
Yeah, Dr. Connie White, tell us about the state radon program.
The state gets a grant from the Environmental Protection Agency also, and so we have free radon kits that are available in health departments across the state. The list is on the website. There are over 40 of our counties have these as long as the supply lasts. If you go to the radon website and your county is not one of those counties, so your health department doesn't have those to give you for free, you can there's a form that you click and apply for a free radon kit. They can also be purchased in stores if you need one.
Good information. Okay, so now let's make another transition, talk about asthma. Dr. Connie White, let's pick up there. What can you tell us about that and the state's efforts?
The state of Kentucky has a higher asthma rate than the United States does, 11.5 versus the U.S. has 8% asthma. It's different in different parts of the state. Central Kentucky actually has a higher asthma rate than the rest of the state does. We know it's the #1 chronic disease in schools when you look at Infinite Campus. So children missing school, having different kinds of health issues in school because of asthma. We know that if you live in a school, in a home that has an income of less than $25,000, your asthma rate is about 8.5%, 18.5%. 18.5%. If your home, your income is $50,000 or more, it's 6.5.
And why does income matter here?
Income matters because of the home that you live in, whether there's mold there, whether there's insect infestation, if you rent and you can't get mitigation from your landlord. Those kinds of issues tend to affect people in lower incomes. That means they miss more work, kids miss more school, which then pushes that income even down further. We know that people with asthma have more emergency department visits, they have more hospitalizations, more diabetes. 49% are obese, and in the 40% with depression. And we have a 17.5% of the persons who have been diagnosed with asthma report they have at least one disability. So it affects us all across as the lifestyle, because if you can't breathe, you don't do a lot of activities that we would like for you to be able to do with your life.
Yeah, Dr. Hahn, and I can't imagine how complicated COVID makes those who deal with asthma.
Oh, absolutely. I mean, anyone with lung disease cannot fight off any type of virus or any kind of infective agent. And of course, COVID, we've all been dealing with it. And I mean, I'm an asthmatic, and I'll tell you, you want to avoid any infection if you can. So
but what about your organization's priorities when it comes to asthma?
Yeah, asthma is key. And as Dr. White said, it's so prevalent. And it's prevalent primarily in low income. We work a lot with low income and historically marginalized populations. And because many of them live in housing that may be, renting, and they don't have access to smoke-free environments, a lot of them don't. And so we actually, knowing all that, when we evaluate and have evaluated and done research on smoke-free laws, interestingly, in Lexington, when we went smoke-free, we looked at emergency room visits for asthma, and we kind of hypothesized that Lexington would see a decline in visits for asthma, and that's exactly what we found. And we've published that, and we found a significant decline in asthma visits to emergency departments for asthma, not only among adults who are going to be protected by our law in the workplace, but even children.
Yeah.
And so that's kind of what we do. I mean, our programs are broader than any one disease because tobacco affects every organ in the body. And so our program, everything we do actually, everything we advocate for, and every community that goes smoke-free is protecting their public, their children and their adults from asthma.
Shannon, I want to ask you the same question about how the Lung Association is taking on asthma.
So this is another area where we can talk about some success in Kentucky. So during the last legislative session, we were able to introduce legislation. In fact, Senator Max Wise, chair of the Education Committee, introduced legislation to allow schools to stock rescue medications for children experiencing respiratory distress. So now schools can stock and administer rescue medications to any kid who's having trouble breathing. And that is an enormous lifesaver, and we're thrilled about that success here in Kentucky.
Yeah. Great step. Well, now let's turn our attention to talk about air pollution. While we have as a society made a lot of progress on air pollution that you can see, scientists are learning that there's a lot of air pollution that we can't see that's doing harm to our health. We want to share a story about a unique study from the Christina Lee Brown Environment Institute at the University of Louisville that's looking at how trees and bushes can be natural air purifiers in communities suffering from polluted air. And then we'll see my interview with the chief investigator, Dr. Aruni Bhatnagar.
It's a Friday morning in November, and a group of volunteers are gathered preparing to plant trees in the Beechmont neighborhood of Louisville. This is not a beautification program. Rather, it's part of the Green Heart Louisville study, which plans to plant 10,000 trees over the next 5 years.
Nature unites us, and nature is also not a nice to have thing. Nature is a must have for life to thrive and to survive. So right now we're in South Louisville, arguably some of the most diverse neighborhoods in all of the Commonwealth of Kentucky. And if you're in South Louisville neighborhoods or you're in West Louisville neighborhoods, you have a life expectancy that is 13 years on average shorter than if you're just in East Louisville neighborhoods, just a few miles away from where we stand today.
The study's chief investigator, Dr. Aruni Bhatnagar, wants to prove that health inequities and disparities in greenness are intimately connected. In a war room, Dr. Bhatnagar and his team intensively analyzed the study area and plot out their strategy.
We have, at least in some parts of the city, very low urban canopy, and our tree plantation efforts have also lagged. And particularly we have focused on areas that are more affluent than areas that have not been so affluent, and there have been systematic neglect over decades that have built up to this depleted tree canopy in areas where we need them the most. The most polluted areas and the areas which have high traffic, high industry presence, that we see the lowest amount of trees.
The project has a clinical component as well, and over 700 local residents have agreed to allow researchers to capture vital health measurements and track them over time as the study progresses. Noise pollution monitors are placed in residents' yards, and air quality monitors are placed strategically throughout the neighborhood.
This is a community project. If we're going to be in the community, we can't just superimpose ourselves like, hey, we're coming in, we're going to do something. We really need it to be a project that we are working alongside our community partners, that we're working beside the residents that want to improve this neighborhood.
One of those partners is Louisville Grows, a local nonprofit dedicated to tree planting in Louisville. They offer free trees to local residents who are called treecipients.
We're planting up to 30 or sometimes even 40 trees in a person's yard, and they're already 6, 7, 8 feet tall. So that not only saves the resident money, time, resources, but also we see that effect on greenness and wellness in the neighborhood immediately.
The big trees are carefully chosen for their effectiveness in filtering bad air and strategically placed.
A lot of the trees that we plant are used in this planting study because, one, they're very heat tolerant, two, the longevity of them, and then also they hold their foliage all year round, which allows them to do their job all year round. I love to plant trees and I love landscaping, but when I found out the scientific impact of this and how this can change people's lives, that's what really motivated me.
So although we cannot change the entire world, the whole socioeconomic structure, maybe changing greenness could address one little part of the disparity, but it would be well worth it. isn't it? I mean, the one part of planting trees is not only that it makes an immediate difference, but it's for many more generations. That's what we're attempting to do something that's fundamental and enduring, so that we would be able to, at least in some small measure, overcome the disparities that have been perpetuated for generations.
Dr. Bhatnagar, thank you so very much for your time today.
Well, thank you for having me on your show, Renee.
Sure. So we want to talk about the Green Heart Study in just a minute, but I want us to first talk about the Envirom Institute. Tell us what it is and why it's an idea whose time has come.
So the Envirom Institute is part of the University of Louisville. It is a sort of a multidisciplinary collection of faculty, students, and staff who are dedicated to the idea that we need to understand our environment in order to understand health and disease. And we think that if we can make inroads in understanding the natural and the social ecosystems, then we might be able to find new ways of promoting health and longevity and delaying aging. So that's the fundamental principle. The main difference that the way it's differentiated from other institutions is that in the Envirom Institute, we are working towards the idea that it would be better to actively promote health than to passively prevent disease. Mm-hmm. Because you see, if you promote health, then you increase resilience to multiple different diseases, rather than trying to play a game of whack-a-mole and say, well, let's prevent cancer, let's prevent asthma, and do all those things. But if you promote health and make people healthier and more resilient, then you can ward off a number of different illnesses. And I think the idea is right because, for one, because we have so many chronic diseases that we do not really know which type and form and multiple afflictions can affect people at the same time. So increasing health resilience rather than trying to chase every disease makes a lot of sense. And the second thing, what we have learned from the COVID pandemic, was that if we do not know what's going to be thrown at us next, right? So all we can do is to prepare ourselves and be more healthy and more resilient.
Yes, makes a lot of sense. Well, your study is focused on cardiovascular disease, but talk to us about the connection to respiratory health and how to treat the body and look at the body as a system.
Right. So the part of the idea of the Envirom Institute is that all the different components of our environment are linked together in the same way as the genome is with all our genome, or our genetics and all our genes are linked together. So is all our body systems, the lung and the heart and the liver and the kidney. They worked in unison to create health. And if even one aspect of our physiological function falls apart, then or dysfunctions, then we have issues in the overall, what we call systemic health. And so lung and heart have a very intimate connection. And we know that one of the strongest predictor of cardiovascular disease, in fact, the strongest predictor of longevity is lung capacity. There isn't anything else that is such a strong predictive value. So having healthy lungs is very critical to having healthy everything else, including a healthy heart and healthy blood vessels. For a second thing, we know that people who are exposed to different toxins through inhalation have problems with their blood pressure regulation and with their cardiovascular function. We know that air particulates, we know that things like COPD, asthma have profound effects on cardiovascular function. But most importantly, pollutant exposure. Most of the people who are exposed to air pollution and they breathe these little particles through their nose and lungs die from heart disease, right? So there is this, what you call cardiorespiratory axis that is one of the principal determinants of health.
So let's return back to the Green Heart Study. What are some of the benefits that you're seeing already?
Right, so going to the connection that in order for us to have healthy hearts, we must have healthy lungs, and we must have healthy and pure air to breathe. And the Green Heart Project was launched with the idea that what if we clean up the air in the neighborhood by planting trees? Trees can remove air pollution, trees can reduce noise, trees can, buffer all these other sort of exposures to people. And so if we increase greenness, would that promote health and particularly cardiovascular health? And so although we've done some initial rounds of studies in the area, we have started beginning to plant our trees there. But we have learned from there and other areas in Louisville that people who live next to trees or live in more green areas are less likely to be exposed to different toxic chemicals from the air. Right? So we study some chemicals like benzene and toluene, and these are called volatile organic compounds. So they're very sort of abundant in our environment. So people who live in greener places seem to be a little bit more shielded from the influence and exposure to these chemicals, because we believe, although we have not proved that yet, that the trees purify the air around the area where they are. The second thing that we found is that there is a lower risk of heart disease among people who live around trees and areas around which are more green than areas that are less green.
So final question, just in just a few seconds if you can. So what does your research mean, do you think, to public health and for those who are involved in urban planning? I mean, you just laid out a pretty good scenario about the purification. Well, how can that really change how we develop our areas around us?
Right, so we radically rethink how we live, and so part of the work we are doing is to provide that justification, not that we need strong justification for having green things around where we live. I think that's absolutely critical. Nature is so important for us because it can, lower anxiety, makes an area more livable, right? And so we need to worry about all of those things. But if we can provide real evidence that how much greenery is required to reduce to what level of pollution, what level of greenness, what types of trees, and where they should be placed. So there is a general enthusiasm. I think there is relatively universal acceptance that we should all be living in green neighborhoods, and every neighborhood wants to be green. But we should know where should we be putting the trees, which trees are better than other trees. Sometimes when you put like lollipop trees on a street, they can actually accumulate more air pollution than disperse it. So we need to know the right geometry, the configuration, the species, the density, and all these things we hope to attempt to answer during the Green Heart Project.
Yes, Dr. Bhatnagar, thank you. That's so intriguing and makes such good sense, actually. So thank you so very much for sharing your research with us.
Thank you again.
Such important work. I mean, really what he's saying is, what we're all saying is that our air is so important and we've got to keep it clean. Right? We've got to keep the indoors clean. We've got to keep the outdoor clean. And a lot of the diseases that kill Kentuckians are from air issues, air quality, poor air quality. Right. So there's so much we can do to clean our air.
And our behavior can be a part of that solution, Dr. Connie White.
Absolutely. Working with people on smoking cessation, preventing people from starting smoking, smoke-free environments, and helping people learn how to take care of themselves, asthma self-management classes, all of those things are critical.
Yeah. Shannon Baker, if you could give us a few takeaways, maybe perhaps of what you heard from Dr. Bhatnagar, but also just in the overall conversation about lung health and its importance and how we all have a part to play.
So I think it's critically important to understand we all have a part to play. We started the conversation at the very beginning talking about funding for the state tobacco prevention and cessation program and how low that level of funding is. Now compare that, if you will, to what Big Tobacco spends on marketing to our kids. I recently read the level is something like $1 from us and $117 from Big Tobacco. That's the level at which we are currently outspent. And the only way to compensate for that is for advocates in the community to ensure their voices are heard. On tobacco, on radon education, the only way to reach a legislator and combat that overwhelming disparity in spending is for voters to weigh in and to say, this is important to me. And so I would just invite everyone to come to lung.org and sign up to be an advocate, to let your voice be heard in Frankfort, and we'll give you all the tools you need to make that happen.
Yeah. Policy change sometimes, Dr. Ellen Hahn, it's incremental. We call it incremental politics sometimes, but that still means that there's progress, right?
Absolutely.
And so where do you hope things will go from here?
Yeah, well, I agree with my colleague that we have to invest because we know the return on investment is huge. For every dollar we spend in tobacco prevention and cessation, we save $55. We can't afford not to invest because we're losing so many precious loved ones in Kentucky to these issues. But the bigger issue is, yes, I think the local elected officials have a role to play, and they have stepped up. I'm very proud of our local advocates and our local officials who have said, we want the best air that we can breathe in our counties, and our workers and our patrons and our residents deserve it.
And it makes a difference in productivity of the citizenry, right? Not just in terms of workforce, but lifestyle and contributions in so many ways.
Absolutely. And to Dr. Bhatnagar's comment about let's just be healthy. Let's do everything we can to keep our lungs healthy. I'm all about that. And like I said, local officials have stepped up and more need to. We have 41 communities. We're at about 37% of our Kentuckians that are covered by good, strong laws, but that means that a lot of people aren't. Yeah. So my message to you as a listener is to talk to your local officials, tell them that you want clean air inside your restaurants, your bars, your workplaces, so that you don't have to think about being healthy. We can make the healthy choices the easy choices.
I knew you were going to say that. I can count on you to bring that line in, and it's a good way to wrap things up. Thank you so very much. You all have been fantastic. Shannon Baker, Dr. Ellen Hahn, and Dr. Connie White. We appreciate you so very much. And for all of those who participated in the pieces that we played earlier, and Dr. Wayne Tuckson. We appreciate you for watching tonight and being a part of this fight to help Kentuckians breathe easier. Thank you all for watching, and we encourage everyone to check out our 3-part series, Fighting to Breathe, which is available on our website on demand at ket.org/respiratory. Remember that anyone with lungs can get lung disease, and clean air is vital to life and well-being. From all of us here at KET, stay safe, take care, and I'll see you real soon.